Hello everybody, I'm Dr. Monica Keta, practicing at Arna Skin and Hair Clinic in Hyderabad. Today I want to discuss something about sensitive skin syndrome, which is a very common syndrome that is misdiagnosed or underdiagnosed. It is also frequently presented, almost 30 to 40% of presentation in India and in many other countries. So what exactly is this syndrome? The patient usually notices that they are having extremely itchy skin or redness, or there is burning sensation on exposure to any external agent, and sometimes even if there is no exposure to any exogenous agents. So this can happen because of pre-existing skin conditions such as eczema or contact dermatitis, seborrheic dermatitis, acne, rosacea, or atopic dermatitis. So these are the pre-existing skin conditions which could trigger sensitive skin syndrome because of loss of barrier function, that is the protective layer of the skin could be disrupted due to many reasons. If not, it can also be triggered because of external agents like UV radiation, variation in the weather or temperature in the specific locality, or if there is pollution. So these are the exogenous agents which could trigger off sensitive skin syndrome. Most of the times it is perceived very differently by different individuals, which brings up this conflict of doubt that it could be purely because of emotional or psychological stress, because there is increased nerve sensitivity and also release of pro-inflammatory cytokines and neuropeptides into the blood circulation, which can bring in immune response. What do we do when we find out that you are suffering with sensitive skin syndrome or reactive skin? Is firstly identify if you have any pre-existing dermatosis like dry skin condition or all the others which I've mentioned earlier. Once we rule those out, then we have to completely stop the cosmetics and other products like face washes, sunscreens with active ingredients in them. Then we give it a washout period of 1 year and then reintroduce one by one all the products that we want to use. So when I say do not use products with active ingredients, then you'll have to use something with purer ingredients in them. For example, your moisturizer should be something as basic as petroleum jelly or colloidal oatmeal, something which will not trigger your immune responses against the skin. And once we diagnose that you're suffering with sensitive skin syndrome, how do we treat the existing symptoms and signs? If you are having redness, blisters from the sensitivity of the skin, or sometimes sensitivity to even a cloth that brushes against your skin, then we need to use topical moisturizing agents and sometimes topical steroids. If there is any ooziness, then we have to combine it with some antibiotic applications. Then orally you have antihistamines which will take care of the immune cell rush to that area.